Do you have spine pain or symptoms and the doctors use terms that you don't understand? Do you wish that you understood just a little bit more anatomy so you could follow along? Well, that's what this video series is for. Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation. I'm fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with spine injuries and spine conditions for over 2 decades now. Please remember, these videos are for informational and educational purposes only. They are not a substitute for medical or chiropractic advice for diagnosis, for treatment, or for any type of recommendations. Seeing the wrong provider can result in an incomplete diagnosis, incomplete treatment, and poor recovery, or regrettably, in some cases, no recovery. So, diving into this topic on spine anatomy, this is the final one of a 4-part series. We talked about the spine with its individual building blocks. We talked about the individual bones, the connective tissue that holds it together, the ligaments in the back, the disc in the front. We talked about how the spine functions to protect the nerves, the spinal cord coming out, the nerves coming out of the spine. So we talked about all that. We talked about the ligaments that hold it all together. We talked about the muscles that connect to make the spine bend and move. We stepped back, we looked at the spine of its different regions. You've got the cervical spine, which is the neck, the thoracic spine, which is anything in the middle that's got a rib attached to it, the low back called the lumbar, and then last but not least, the tailbone or the sacrum, which is where the lumbar spine rests on that. It's between the pelvis. We looked at the whole spine model. So now today, we're going to step back and we're going to just take a look at the whole thing working together. And this is called spinal biomechanics. So that sometimes sounds like a mouthful, but the reality is that the spine is not static. It does not just stay in one spot. It's designed to do something. So there are 6 cardinal directions, and cardinal means primary directions that the spine has to move. Now, you can use your fingers in this analogy to take a look at it. The spine has to be able to move forward and backwards. It has to be able to move to my left, to my right, and then up and then down. So those are the 6 motions that the spine has to accomplish. Now, there is a new term I'm going to introduce. It's called coupled motion. You see, when you want to bend forward and to the side, so like I bend my head down and look here, as I do that, that's a coupled motion. In the neck and in the cervical spine, all right, where these muscles are, these bones couple and move in the right direction. So it has to spin and move, and it has to be very limber, and it has to be very, can't be any restriction. In the low back, the coupled motions are a lot different. In the middle back, where there's ribs that attach to it, the coupled motions are even more different than the neck. And you can probably visualize that and understand how that would be. So when it comes to normal spine biomechanics, there's typically 2 extremes that the human body needs to stay away from. On the one end are joints that are totally jammed and restricted. That right there can be a source of restricted range of motion. It can be a source of symptoms. It can be a source of pain. So not enough motion, a jammed, restricted joint, is problematic. On the other extreme are joints that are too hypermobile. That can happen where there's injury, where there's tearing of the connective tissue, and the joint becomes progressively more unstable depending on how much trauma happened to it. Sometimes people are born with connective tissue disorders where the ligaments are very lax and sloppy in their spine, and so there's way more motion than they can handle. That too can be very symptomatic. Joints that are too loose, the muscles will spasm to try to stabilize that. The joints can move incorrectly. They can wear and tear on each other a lot differently. There can be inflammation with that. On the same end of the spectrum, on the opposite end, on the same spectrum, on the opposite end, joints that are compressed that aren't moving, when you try to move them, same thing, you can get inflammation from there. So there's this happy medium where the joints have to bend and move together. Last but not least, when we look at the whole spine as an organ system, so we have the different joints where there's precision motion at the individual joints. Then we look at range of motion at the regional level, like the neck has a different range of motion that you can measure. That's going to be different than the low back range of motion. And then there's the whole spine where it has to bend and flex and move together. The net spine interacts with the hips. So somebody who has a hip problem where they can't hinge at the hip when they bend over, they're going to transfer that range of motion above or below. They're going to compensate with their knees. They're going to compensate with their lower back. So understanding the global range of motion of the whole body, looking at how the whole body is supposed to bend and move in space, and also looking at how you walk, because when you walk, the spine twists and turns and goes with that. It's very critical. So spinal biomechanics is the end result of normal spinal motion that's supposed to be there. So you'll hear that phrase used sometimes as part of somebody's recovery where they're talking about range of motion. So I hope you found these videos to be helpful. I hope you understand just a slight overview, a better overview of normal spinal anatomy, the relationship between all the different regions, how they are classified, how they are discussed. I hope this helps you understand what you were looking for in terms of spine anatomy basics. You have a lot of different videos that you can pick from. I'm honored that you chose this one. And until we meet again, have a blessed day.